Welcome to Simple Science with Professor Myers, where we take complex topics and break them into easily digestible little bits for you. Today, we're going to look at the endocrine system. More specifically, we're going to do the hypothalamus and the posterior pituitary. Both the hypothalamus and the pituitary gland are located inside the brain. So when we look at the names, it's going to tell you where it's located. Hypothalamus. Hypo, beneath, thalamus, thalamus. So this is beneath the thalamus inside the brain. It's the green area. Your pituitary gland's technical name is hypopoiesis. Hypo, beneath, poiesis, growth. So it's the growth that hangs off at the bottom. You're going to notice there's two different colors associated with it. The orange is going to be your anterior pituitary. That pink is going to be your posterior pituitary. We're going to very generically give the hypothalamus three main functions. We're going to have the production of oxytocin and the production of antidiuretic hormone, which is abbreviated ADH. The hypothalamus also regulates the anterior pituitary gland. So it's going to release a bunch of releasing hormones, which is going to cause us to release hormones from the pituitary. The way we're going to remember this is HOA, Homeowners Association. So hypothalamus, H, makes oxytocin, O, and antidiuretic hormone, A. First, let's look at oxytocin and antidiuretic hormone. These are both made by nucleuses inside the hypothalamus. They then travel down to the posterior pituitary where they are stored until they're ready to be released. Antidiuretic hormone is made by the supraoptic nucleus. Supraoptic, above the eye. So this nucleus is located above the optic chiasma, which is where cranial nerve number 2 comes and make contact with the brain. So it produces the antidiuretic hormone, is transported down to the posterior pituitary, where it is stored until it's ready to be released. Oxytocin is then produced by the paraventricular nucleus. Para means around, so these are around the ventricles inside the brain. So oxytocin will then be produced there. They will travel down and be stored in the posterior pituitary. Where I remember which hormone is made in which nucleus is I think about the letter O. O is in oxytocin, so it is not in the nucleus. Antidiuretic doesn't have one, so O is inside the name of the nucleus. Let's look at oxytocin now. Oxytocin is the love hormone. It has OX, so hugs and kisses. Oxytocin is going to give you the feeling of love. It also has a couple of other functions. So we're going to look at the stimulus. That's what causes you to release it. So stimulus, cervical and uterine stretching, so contraction. So you go into labor. These contractions then cause you to have more contractions. So the effect of oxytocin is increased contractions. This is positive feedback. So you have contractions, which causes you to release oxytocin, which causes you to have contractions, which causes you to release oxytocin, which causes you to have more contractions. All of this continues until you give birth. Then the doctor hands you this baby. Looks a little bit like a troll, but you fall madly in love with it. Why? Oxytocin gives you the feeling of love. Another function of oxytocin involves milk. So you have a stimulus, you place an infant at your breast. This causes you to release oxytocin. Oxytocin then causes milk ejection, so milk exiting the breast tissue. Remember, oxytocin makes you feel love as well. So you're nursing this baby, it's 2 in the morning, and you just look at its little face and it's so cute and you love it so much because you're releasing oxytocin. This occurs until it's inhibited, and that will happen when the baby is no longer at the breast. The next hormone we're going to address is antidiuretic hormone, or ADH. This is involved in urine production. So, for example, we have our stimulus. This can either be an increase in osmolarity of the blood, which will cause an increase in the solutes like sugars and salts, or it can be caused by dehydration. All of them are going to decrease the blood volume. So it's going to decrease the amount of water in the blood. This is going to decrease your blood pressure. This causes you to release antidiuretic hormone. Antidiuretic hormone is going to decrease the urine that you produce. So it goes to the kidney tubules, makes them reabsorb the water. This increases the blood fluid, which is then going to increase the blood volume and increase the blood pressure. Once adequate hydration has been reached, so you have an increase in your blood volume, then we're going to inhibit the production of antidiuretic hormone. This is an example of negative feedback. Okay, a recap. HOA, Homeowners Association. Hypothalamus produces oxytocin and antidiuretic hormone. Oxytocin, OX, hugs and kisses, love feeling, labor contractions, ejection of milk. Antidiuretic hormone, opposite of a diuretic. Diuretics make you go pee. Antidiuretic makes you not go pee, so it's going to increase your blood volume. Another very important function of the hypothalamus is that production of releasing hormones. These travel over to the anterior pituitary and cause it to release various hormones like growth hormone, thyroid stimulating hormone, all of those, and it's controlled by that hypothalamus. Way to remember that is think of an HOA again. So you have that homeowners association that tells you what you can and cannot do. So it tells the anterior pituitary what it's releasing. If you like my content, please subscribe to my channel and check out my book series on Amazon called Simple Systems. Currently, I have stuff on the endocrine system, introduction to anatomy and physiology, respiratory system, and blood. More titles are to come in the future. Happy studies and good luck in anatomy.